Welcome back to SA Live. Well, April is Parkinson's Disease Awareness Month. About 7 to 10 million people around the world are diagnosed with it. Now, the disease isn't curable, but Methodist Hospital wants you to know there is hope for a better tomorrow. And joining us now is Dr. Ryan Kuchansky, a neurosurgeon at Methodist Hospital. Welcome, welcome. Thank you so much for being here.
Thanks for having me.
All right, so let's talk about what exactly Parkinson's disease is. Tell us a little bit about the symptoms.
Yeah, so Parkinson's disease is a neurodegenerative disorder, and what that means is it's caused by a loss of a very important chemical deep within our brain called dopamine. Dopamine is critical in terms of driving the neurocircuitry for movements, smooth movements that we make. When we lose dopamine, we lose the ability to have smooth, coordinated movements. And what does that lead to? It leads to the three main symptoms of Parkinson's disease: tremor at rest, so shaking, rigidity or tightness, and then slowness, bradykinesia. Imagine dopamine as the oil to an engine. That's what drives the neurocircuitry, and when we lose it, we lose the ability to function appropriately in our normal everyday movements.
So is there treatment, and if so, how does that work?
Yeah, so medications are quite effective for early stage disease and controlling the symptoms, but what happens over time is that the medications lose their effectiveness. They become harder to dose, or sometimes they cause significant side effects and patients can't take them anymore. And so in those instances, something called deep brain stimulation is a great option for those patients. It involves placing wires deep within the brain to very precise locations and turning on special electrical current that then drives the neurocircuitry of the brain to produce more smooth movements. So imagine it's adding oil to that engine that's been without oil for a long time.
So who's a candidate for that deep brain stimulation?
Yeah, so folks that have those main symptoms of Parkinson's disease, tremor, rigidity, or bradykinesia, can be, patients have it's a very heterogeneous experience in terms of the disease for each patient. Some patients have more tremor than, say, rigidity or more bradykinesia. And so any one of those symptoms and the ability, and where medication is no longer as effective, those patients are great candidates for this procedure.
Okay. And so what's different about the way deep brain stimulation is done, surgery is done there at Methodist compared?
Yeah, so historically these types of surgeries are done with patients awake. And the reason why we do the surgery awake is because we're putting a wire very close to other important structures that control movement. And so we want to make sure when we turn it on that the patient's not having any side effects related to the stimulation. At Methodist, we have special technology consisting of an intraoperative MRI machine, so an MRI magnet that actually comes into the operating room. And we also have a special targeting software called ClearPoint software, which is able to deliver a wire to the exact location within a millimeter to wherever we want it to go. So we know that if we place it accurately in that location, we won't have side effects. And so what does that allow us to do? It allows us to do this surgery without the patient being awake. The patient can be under general anesthesia. Patients just go to sleep, and me and my team, we do all the hard work and we do the surgery.
Wow, technology, amazing. Thank you so much. All right, take steps, of course, towards a brighter tomorrow. You can learn more about your options at Methodist Hospital by calling 210-575-0355 or visit the website sahealth.com/Parkinsons. Doctor, thank you so much. Appreciate your time.
Thank you, Fiona.